In 2011, before Steve Jobs died, he shared something important. He said, eat your food as medicine. Otherwise, you may end up eating medicine as your food. The reason why I bring up that is because the topic I'm going to share today cuts across sectors, and this is antimicrobial resistance. Most of us have heard about it. In fact, every year, WHO dedicates a full week to create awareness on antimicrobial resistance. What is antimicrobial resistance? Antimicrobial resistance, this is when microbes, we shall understand what this is, mutate or adapt in ways that they no longer respond to the drugs that used to kill them. Antimicrobial resistance, as you can see, we have the microbes, we have resistance. So we have these microbes, or what we call microbials. So when I solve this, these are disease-causing germs or pathogens per se. And they can either be bacteria, they can be fungi, they can be even parasites. Now, antimicrobials, these are drugs that we use in the treatment of infectious diseases that affect humans, that affect plants, that affect animals. So as you can see, this sector cuts across the humans, those involved in plants, those involved in animals, but most important, even the general public. It is an ecosystem. So by the end of this video, we should be able to appreciate what antimicrobial resistance is, how it comes about, what are the drivers, and then what should we take in action to curb it. Antimicrobial resistance, like as I've said, it is when these microbes mutate or acquire genes that enable them to survive even in the presence of the drugs that used to kill them. But how does resistance occur? Antimicrobial resistance is a natural phenomenon. It happens over time, naturally. And this happens because when we expose drugs to these microbes, they mutate. Simultaneously, they can mutate. Or they can actually acquire resistant genes from the environment. And there are different ways how these microbes acquire genes from the environment. It can either be through what we call transformation, or what we call conjugation, or what we call transduction. Now, when microbes become resistant, they put gains of modern medicine at risk. It is actually through the advent of these antibiotics after the First World War that we saw modern medicine expand to have now treatment of cancer by chemotherapy. We have different types of surgeries, cesarean sections, and these procedures involve use of these antimicrobials, the drugs. So in case we have these microbes not responding to these drugs, when they become superbugs, they are resistant, it means that they will increase in number and then they can spread to other people. And when that happens, it puts the entire population at risk. In fact, in 2019, WHO estimates that close to 1.3 people died because of antimicrobial resistance directly. But then also it's important to appreciate that when people have these resistant microbes, they will spend more days in the hospital. And this comes with increased costs, longer hospital stays, and some actually die. It also puts a burden on the health sector. Why? It will necessitate having facilities like intensive care, and this comes with the increased costs. So we all have a stake to play in curbing this global threat. But then we are implicated. Why? There are two key drivers of this antimicrobial resistance, and this is overuse or misuse of these antimicrobials. When I say misuse, this is what I mean. We have seen that people do a lot of self-medication. When I say self-medication, is when a person asks for an antibiotic even without a prescription. And it is so common. In fact, Uganda was ranked as one of the countries in the world where drugs or antibiotics are misused. Two, we have seen people that come and buy human drugs and use them for animal use, either for treatment of animal diseases or to enhance animal fattening or growth. And this is common. People buy ARVs or they get ARVs from government and then they go to use to fatten either chicken or piggery or even other animals. Now that is not right. Why? These drugs also accumulate in animal tissue. And at the point when someone is consuming their meat, they end up consuming this drug in smaller doses. And these small doses actually trigger these mutations that we talked about, making these microbes resistant. So stop using human drugs to fatten or to treat animal diseases. Rather, go to a vet facility and then they give you the right medication. We also have seen humans that walk in and then buy these antibiotics to treat viral infections like flu or cold. Let me stress this. Antibiotics do not work on viral infections. We have also seen people, they buy medication, but they never finish the dose. Either the drug was expensive or the side effects were really unpleasant that they wouldn't continue, or they felt better and they felt no need of continuing with the dose. Let me highlight this. It's important that you finish the entire treatment as recommended by the prescriber. Why? When you take half dose, it means you have just killed a certain percentage of these microbes. The ones that you've left, they'll reproduce and come back, some of which may be resistant. 2, in case the cost was expensive, it's important that you talk with your healthcare provider to select a course that is relatively cheaper that meets your budget. Or alternatively, in case the side effects are really unpleasant, you can always share with your musao. We have alternative medications that are really safer on your body. It's true that some of us are sensitive to some of these drugs. It's important that you share so that we give you the medication on which you will not react. Now, what role do we have to play in this? It's a multifaceted problem, and it encompasses those in health facilities, the basao, it encompasses the general public. We have a role to play. Those in agriculture, we have a role to play. In fact, that's where we call what we call the One Health program, whereby we are looking at a sector-specific approach, but then also an approach of all the cadres involved in use of these drugs, so that we come up with a strategy that looks at mitigating the spread of antimicrobial resistance. So on the side of the public, this is what you have to do. 1, ensure that you wash your hands with water and soap. Whenever it is soiled or whenever you visit the toilet, ensure that you wash your hands so that you do not spread these resistant microbes. 2, ensure that when you get medication, you finish the full treatment. 3, do not self-medicate. Also, do not buy this medication to go and use the human medicines, to go and use to treat your chicken or to go and fatten your piggery. It's not right. Now to the healthcare workers, the healthcare professionals. There's what we call antimicrobial stewardship, and this is aimed at supporting, educating the healthcare professionals to follow evidence-based prescribing, and then also to administer drugs in the right way. And because of that, we need to follow guidelines so that we start with drugs that are recommended as first line. We do not jump to the last resort. Some drugs are reserved for emergency cases. So to the healthcare professionals, ensure that you follow guidelines in prescribing these antibiotics. Do not just jump to the last resort. First, follow the guidelines. But then also, it's important that all health facilities install hand washing facilities. Patients wash their hands so that they do not spread to others. It's important that all health facilities have the diagnostic facilities, labs, so that we arrive at the right diagnosis before we recommend these antibiotics. It's also good that we carry out surveillance on the use of these antimicrobials. Most people misuse them, but if we have to carry out surveillance, we understand the usage, and then to help us in knowing which drug is misused so that we can put key emphasis in regulating it. Then to other sectors like the National Drug Authority, they are playing actually a good role. We do not want substandard or falsified medications on market. Some of these are adulterated or they have lower quantities, and these are really not good. So safeguard our antimicrobials, all these drugs that we use, lest we put the gains of modern medicine at risk.